Basic medical terminology. Throughout your training, you will come across many medical terms and abbreviations, and it's important that you understand what they mean. Medical terminology is like a foreign language. It's the language of healthcare. When you're communicating with your patient and their family, it's important to use basic terminology. But when communicating with the healthcare team, you will be able to give more complete information if you use medical terminology. Basic medical terminology is the same for all healthcare providers, from physicians to medical coders to insurance companies. Errors in documentation or the incorrect use of a medical term can confuse orders and result in the wrong treatment for the patient. Medical terminology allows all healthcare providers to communicate clearly and with one another in a universal language. It would be impossible to cover all medical terminology, so the basic terminology will be covered in this module. Every home health aide should carry a pocket guide with medical terminology to understand the client's condition and their care. Medical words have three parts: the root word, the prefix, and the suffix. All medical terms have the root word, and most have either a prefix or a suffix or both. The root word. All medical terms begin with a fundamental piece, the root of the phrase. Understanding the root words make it easier to understand the word and figure out the prefixes and suffixes. Here are some common root words. Dermo is pertaining to the skin. Gastro is pertaining to the stomach. Hemo is pertaining to the blood. Pulmo is pertaining to the lungs. Cephalo is pertaining to the head. And phlebo is pertaining to the veins. Sometimes medical terms have a word at the beginning of them that have specific meanings. A is absence of or without. Ante is before. Ecto is out. Endo is within. Post is behind or after. Mon is one. Poly is many. Trans is across. And supra is above. Some medical terms end with words that have specific meanings. Algia means pain. Emia means blood. Plasty means repair. And sclerosis means hardening. And urea means urine. Here are some examples of some medical terminology. Pericarditis, broken down, would be peri, around, card, the heart, itis, inflammation. And so pericarditis is inflammation around the heart. Another common one is postpartum. Post means after, and partum means childbirth. So postpartum is a period of time after childbirth. Abbreviations are another way of communicating more efficiently with other members of the healthcare team. Make sure to learn the standard abbreviations that your agency uses. Using these abbreviations can help you document more efficiently and accurately. Here are some common abbreviations that you will frequently see. PO means by mouth. PRN means as needed. Q means every. QID means 4 times a day. BID is twice a day. And TID is 3 times a day. SOB stands for shortness of breath. STAT stands for right away. PWB stands for partial weight bearing. TPR stands for temperature, pulse, and respirations. VS stands for vital signs. ABD stands for abdomen. AC stands for before meals. ROM stands for range of motion. BM stands for bowel movement. And BP stands for blood pressure. C stands for with. You often see that C with a line on top of it. CO stands for complains of. CHF stands for congestive heart failure. CPR stands for cardiopulmonary resuscitation. DC stands for discontinue. And DX stands for diagnosis. FBS stands for fasting blood sugar. FWB stands for full weight bearing. GI stands for gastrointestinal. I and O stand for intake and output. NKDA stands for no known drug allergies. NPO stands for nothing by mouth. NWB stands for non-weight bearing, and PC is for after meals.